Welcome to Guardian Home Care, where we dedicate ourselves to supporting the safety and well-being of our beloved guardians, the elderly who deserve the best care at home. Today, we're focusing on a crucial topic: fall prevention and what to do if a fall happens. Falls are one of the most common and serious risks faced by seniors living at home. But with the right precautions and knowledge, many falls can be prevented. And if one does happen, quick and calm action can make all the difference. Step 1. Understand the risks. Seniors can face many factors that increase their risk of falling, such as muscle weakness, poor balance, vision problems, or certain medications. Knowing these risks helps caregivers and family members create a safer environment tailored to each guardian's needs. Step 2. Medication review. Some medications can cause dizziness or drowsiness, increasing fall risk. It's important to have a healthcare professional review all medications regularly. Step 3. Home safety modifications. Removing clutter, securing loose rugs, and taping down cords can prevent trips and slips. Make sure pathways are clear and frequently used items are easy to reach without stretching or bending dangerously. Step 4. Install safety aids. Grab bars near the toilet and shower, non-slip mats, and sturdy handrails on stairs are essential supports. These simple modifications provide extra stability and confidence when moving around the home. Step 5. Encourage proper footwear. Shoes with non-slip soles and good support reduce the chance of slipping. Avoid walking in socks or slippers that lack grip, especially on smooth floors. Step 6. Promote regular exercise. Gentle strength and balance exercises improve stability and mobility, reducing fall risk. Physical therapy or guided group classes tailored for seniors can make a big difference. Step 7. Improve lighting. Poorly lit areas increase the chance of missing hazards. Install bright lights and night lights along common paths. Step 8. Use emergency response systems. Wearable alert devices or emergency buttons allow guardians to call for help immediately if a fall occurs. This technology provides peace of mind for both seniors and their families. Despite all precautions, falls can still happen. So it's vital to know exactly what to do if a fall occurs. Step 1 after a fall, stay calm and reassure your loved one. Check for injuries without moving them unnecessarily. Step 2. Assess injuries. Look for bleeding, bruises, or swelling. Ask if they feel pain anywhere. If the person is unconscious, confused, or in severe pain, call emergency services immediately. Step 3. Call for help if needed. Even if no serious injury is apparent, medical evaluation may be important, especially after a fall. Step 4. If no injuries are found and the person feels able, help them get up slowly. Use sturdy furniture or assistive devices for support. Avoid rushing and always support their weight to prevent another fall. Step 5. Once up, encourage rest and hydration. Monitor them closely for any delayed symptoms like dizziness or pain. Step 6. Document the fall. Record details such as when and where it happened, circumstances, and any injuries. This information helps healthcare providers adjust care plans to prevent future falls. Fall prevention is an ongoing effort requiring teamwork between guardians, caregivers, and family. By staying vigilant, making the home safer, encouraging healthy habits, and preparing for emergencies, we can protect our guardians and support their independence. Thank you for watching. For more tips on caring for your loved ones, subscribe to Guardian Home Care. Together, we can create safer, happier homes.
Hello, friends. Welcome to my Guardian Home Care YouTube channel with the new video about Elder Guardian, Forgotten Memories, how photos, smells, and music stimulate the memory. Let's start. There are moments in life that never truly fade. For elder guardians, those who have dedicated their lives to guiding, protecting, and caring for others, memories are more than just reflections of the past. They are a living testament to a life well lived. Yet, as the years pass, those moments can feel distant until something familiar calls them back. A photograph, a song, a scent carried on the air. These simple triggers can unlock a flood of emotions, bridging the past and the present in a way that words alone cannot. Part 1. The role of elder guardians in memory and legacy. Elder guardians are more than loved ones. They are the keepers of wisdom, the anchors of family tradition, and the living memory of communities. They have carried stories, customs, and values across decades, often without realizing how precious these treasures truly are. But even the strongest among us can find those memories slipping away with time. For elder guardians, reconnecting with their own life's moments can be a source of joy, pride, and renewed purpose. And the path to those memories often lies in the senses: sight, sound, and smell. Part 2. The power of photographs. Photographs are like keys to the doors of our past. For elder guardians, they are a visual proof of a lifetime's worth of love, service, and impact. A photograph does not merely show what happened. It recalls how it felt. The smell of the room, the sound of laughter, the warmth of a hand held tight. And by looking at the photos, people also regain a sense of happiness and self-esteem, and that they still matter. This feeling makes a big difference in the elderly's depression. When sharing photos, avoid testing their memory with questions like, "Do you remember this?" Instead, narrate what you see together. Say, "This is you with the children at the park. Look at those joyful faces." Such gentle cues invite the memory to surface without pressure. Creating a dedicated photo album for an elder guardian can become a cherished project. Involve family members in selecting meaningful pictures. Add short captions that describe the people, the event, and even the season. The result is more than a book. It's a portable time machine. Part 3. The melody of the past. Music has the remarkable ability to awaken emotions and memories in a way nothing else can. For elder guardians, a song from their youth can bring back the rush of first love, the joy of dancing, the pride of a milestone celebration. Even when words are lost, melody remains. The brain processes music differently than it does language. This is why songs from the past can reach corners of memory that even conversation cannot touch. A playlist of favorites, played during the morning routine or in the quiet of the evening, can become a gentle ritual of connection. Movement often follows music. A slow dance, a sway in the chair, or even clapping along can awaken joy and energy, making the moment not just about remembering, but about truly living. Part 4. Scents that tell a story. Smell is the most direct pathway to memory. For elder guardians, certain scents can instantly transport them to another time. The smell of homemade bread might recall a mother's kitchen. The scent of freshly cut grass might evoke summer afternoons playing outside. Lavender might bring back the peaceful quiet of a countryside home. Introducing familiar scents can spark vivid memories. The key is to present them slowly, allowing the elder guardian to linger in the memory each scent awakens. Some may bring laughter, others quiet reflection. All are a bridge to the past. Part 5. Combining senses for deeper connection. The strongest memory triggers happen when multiple senses are engaged together. A wedding photograph paired with the couple's favorite song and the scent of roses can recreate the feeling of that day. A holiday picture with the smell of cinnamon and the sound of a carol can bring back the warmth of family gatherings. These sensory combinations are powerful, not just for recalling memories, but for deepening emotional bonds between elder guardians and their loved ones. Part 6. Emotional benefits for elder guardians. For elder guardians, reconnecting with personal history is more than an act of remembrance. It's a reaffirmation of identity. These moments can boost mood, reduce feelings of isolation, and even improve communication with family and caregivers. Part 7. Practical tips for caregivers and families. 1. Keep memory items easily accessible. 2. Use large, clear images with captions. 3. Choose scents and songs that are personally meaningful. 4. Avoid overwhelming stimuli. Gentle and familiar is best. 5. Observe and respond to their emotional cues. Memories are not just pieces of the past. They are the heartbeat of who we are. For elder guardians, these memories carry the weight of a lifetime's worth of love, sacrifice, and joy. Through a photograph, a melody, or a familiar scent, we can help them hold those moments close, because every memory matters. If you think this video is helpful for you and for your guardian, please subscribe this YouTube Guardian Home Care family. See you soon.
Hello friends, welcome to my new video on good oral hygiene. Let's start. Oral hygiene might seem like a small detail in daily caregiving, but for older adults, it plays a far bigger role than most people realize. A healthy mouth is essential for eating, speaking, and smiling comfortably. But beyond that, it also protects overall health, prevents infections, and ensures dignity and quality of life. Unfortunately, poor oral hygiene can lead to pain, fungal infections, difficulty eating, and even serious health deterioration. In this video, we'll explore why good oral hygiene is so important, practical tips for brushing and maintaining dentures, and what happens when oral care is neglected. Part 1. Why oral hygiene matters more than ever in old age. As we age, oral care becomes more critical. Many seniors take medications that cause dry mouth, which increases the risk of cavities and infections. Some struggle with reduced mobility, making it difficult to brush thoroughly. Others rely on dentures, which require special care to avoid painful sores and bacterial buildup. Without good oral hygiene, the simple act of eating can become uncomfortable, leading to malnutrition, weight loss, and weakened immunity. Oral health is not separate from overall health, it is deeply connected. Part 2. The consequences of poor oral hygiene. Neglecting oral hygiene has serious consequences. Some of the most common include fungal infections or oral thrush, a painful condition where fungus builds up in the mouth, causing white patches, soreness, and difficulty swallowing. Tooth decay and gum disease. These conditions lead to pain, bleeding gums, and even tooth loss if untreated. Difficulty eating. Painful or loose teeth, infected gums, or sore dentures can make chewing impossible, leading to eating less and malnutrition. Bad breath and loss of confidence. Poor hygiene can affect social interactions and emotional well-being. Overall health risks. Oral bacteria can enter the bloodstream, increasing the risk of pneumonia, heart disease, and worsening diabetes. Poor oral hygiene is not just about the mouth. It can trigger a domino effect that impacts the entire body. Part 3. Daily brushing tips for older adults. Daily brushing remains the foundation of good oral care. Here are some practical tips for caregivers and seniors. 1. Use a soft bristled toothbrush. Gentle bristles protect sensitive gums. 2. Brush twice daily, morning and night for at least 2 minutes each time. 3. Fluoride toothpaste. Help strengthen enamel and prevent cavities. 4. Electric toothbrushes. Can make brushing easier for those with limited hand strength. 5. Don't forget the tongue. Gently cleaning the tongue removes bacteria and keeps breath fresh. 6. Encourage rinsing. If brushing isn't possible after meals, rinsing with water can wash away food. Part 5. Recognizing oral infections. Oral infections are more common in seniors than many realize, and early recognition is vital. Some of the most common include oral thrush or fungal infection, caused by an overgrowth of yeast in the mouth. It shows up as white patches, soreness, or a burning sensation. Gum infections, or gingivitis and periodontitis. These start with swollen, bleeding gums and can progress to tooth loss if untreated. Mouth sores and ulcers. Painful spots that may appear due to poorly fitting dentures or fungal growth. Dry mouth-related infections. When saliva is reduced, bacteria and fungi thrive more easily. Left untreated, these infections don't just cause pain, they make eating and swallowing difficult, leading to weight loss, malnutrition, and further health decline. Caregivers should always pay close attention to signs like unusual patches, redness, bad breath, or complaints of burning sensations in the mouth. Part 6. How oral pain affects nutrition and health. Pain in the mouth can transform mealtime from a moment of joy into an experience of dread. Seniors who struggle with tooth pain, gum infections, or poorly fitting dentures may choose to eat less or avoid eating altogether. Over time, this leads to reduced appetite. Pain makes food unappealing. Nutritional deficiencies. A lack of fruits, vegetables, and proteins weakens the immune system. Weight loss and muscle weakness, which increases the risk of falls and frailty. Emotional distress. Eating is a social activity. When it becomes painful, seniors may withdraw from family meals, leading to loneliness and depression. The mouth is the gateway to the body. When it suffers, the entire body suffers. Protecting oral health directly protects overall well-being. Part 7. Caregivers' role in supporting oral hygiene. Caregivers play a critical role in maintaining oral hygiene. For many seniors, physical limitations, memory loss, or health conditions make daily care difficult. Here are practical ways caregivers can help. 1. Assist with brushing. If your loved one struggles, offer support. Sometimes guiding their hand is enough. 2. Set a routine. Consistency helps, especially for those with memory challenges. Brushing at the same times each day builds a habit. 3. Prepare dentures daily. Clean them gently and remind your loved one to take them out at night. 4. Offer comfort. Always approach oral care with patience and encouragement, never force. Gentle reassurance turns a stressful task into a caring moment. 5. Watch for warning signs. If you notice bleeding gums, bad breath, or sores, contact a dentist promptly. When caregivers make oral hygiene part of daily care, they are not just protecting teeth, they are protecting health, dignity, and comfort. Part 8. Professional care. Dentists, hygienists, and checkups. While daily care at home is essential, professional dental checkups are equally important. Dentists and hygienists can spot problems that caregivers may miss and provide treatments to prevent more serious issues. Seniors should ideally have 1. Regular dental visits, at least once or twice a year, even if they have no natural teeth. 2. Denture checkups, to ensure dentures still fit well and do not cause sores. 3. Cleanings and screenings, to remove plaque, check for infections, and catch early signs of oral cancer. 4. Specialized advice, for those with dry mouth, diabetes, or other conditions that affect oral health. Professional oral care, combined with daily routines at home, ensures a complete circle of protection. For caregivers, partnering with dental professionals provides confidence and peace of mind. Join our Guardian Home Care family to get regular Guardian Care tips. Please subscribe our channel and like and share the video with your network. See you soon.
Welcome to Guardian Home Care, where compassion meets care. In today's video, we're going to walk you through the daily routines and meaningful activities we implement to enrich the lives of our clients. Whether you're a family caregiver or considering professional assistance for your loved one, understanding the structure of daily care routines is essential for quality of life and well-being. 1. Why daily routines matter in elder care. Daily routines are more than schedules. They are anchors of stability, familiarity, and dignity for older adults. For those living with memory challenges, dementia, or physical limitations, a structured day can reduce anxiety, confusion, and feelings of isolation. At Guardian Home Care, we focus on person-centered routines. This means every plan is tailored, adjusted to the individual's needs, medical condition, preferences, and personality. 2. Morning routine, starting the day right. A gentle start to the morning sets the tone for the rest of the day. Here's how a typical morning might look. Wake-up assistance. We begin with soft light and a warm, calm greeting. Caregivers assist with stretching, sitting up, and adjusting to being awake. Never rushed, always respectful. Para-grooming, our caregivers help with brushing teeth, washing the face, shaving, applying lotion, or styling hair. Maintaining hygiene not only boosts physical health but preserves dignity. Toileting support. We provide privacy and support for toileting or incontinence care using gentle, trained approaches to avoid discomfort or embarrassment. Dressing assistance. Clients choose their clothing whenever possible. Independence in choice encourages self-expression and comfort. Morning medication reminder. We administer or remind clients to take their prescribed medications, ensuring safety, accuracy, and documentation. 3. Breakfast time, nutrition, and connection. A nutritious breakfast isn't just about food. It's a moment to socialize and mentally prepare for the day ahead. We prepare meals tailored to dietary needs, whether it's diabetic-friendly, low-sodium, or pureed textures. Hydration is encouraged through warm water, herbal teas, or juice. Breakfast can be a great time for light conversation or listening to the radio for cognitive stimulation. Guardian Home Care ensures every meal is balanced, enjoyable, and safe to eat, especially for those with chewing or swallowing difficulties. 3, 2, 1. Mid-morning activities, movement, and mindfulness. Mid-mornings are ideal for light activity and mental engagement. Some examples include stretching or mobility exercises. Simple movements help prevent stiffness and promote circulation. Memory games and puzzles. Crossword puzzles, memory cards, or apps designed for seniors with dementia are often part of our routine. Creative expression. Art, music therapy, coloring, or storytelling taps into emotion, encourages joy, and builds connection. Pet therapy or music therapy, if available. These bring sensory stimulation and happiness, especially to those feeling withdrawn or anxious. 5. Personal care and bathing, midday hygiene routine. For many seniors, bathing is a vulnerable task. Our caregivers approach hygiene with the utmost sensitivity and safety. We follow a set routine, same time, same method, to ease anxiety. Non-slip mats, shower chairs, and handheld nozzles make bathing safer. Bed baths are available for clients with limited mobility. We also check for signs of skin issues, pressure sores, or other health indicators during this routine. 6. Lunch. Nourishment and a midday reset. Lunch is a significant part of the day, not just for calories, but as a pause, an emotional reset and time to connect. At Guardian Home Care, lunch is prepared fresh or warmed as needed, nutritionally customized, offered with hydration, often soup or smoothies for added fluid, followed by gentle cleanup and rest. Caregivers sit beside clients when possible. Sharing this moment helps reduce loneliness. 7. Afternoon rest, a quiet period for recharging. After lunch, it's time to slow down. Afternoon rest isn't always about deep sleep. It could mean a nap, listening to relaxing music, watching TV, or looking through photo albums. Quiet time restores energy and improves mood. For those with dementia, overstimulation can be overwhelming, so this peaceful break is essential. 8. Late afternoon activities, joy and stimulation. We reintroduce gentle engagement to transition from rest to evening. Activities vary based on client abilities. Gardening or patio time, sunlight and fresh air, boost vitamin D and mood, light housework with guidance, folding towels, watering plants. These tasks give purpose and confidence. Reading or audiobooks. For clients with vision loss, we offer large print books or calming audiobooks. Reminiscing or family video calls. A photo album or a call with grandkids brings immense joy. Winding down with comfort food. Dinner time focuses on comfort and closure. The evening meal is warm and familiar. Soft casseroles, rice dishes, soups. Lower in calories but rich in fiber and hydration. Paired with soft lighting and a calm environment, we support those with chewing or swallowing difficulties using proper positioning, utensils, and food textures. After dinner, we encourage clients to participate in cleaning or just enjoy light conversation. Evening routine, preparing for rest. Just like in the morning, the bedtime routine is consistent and peaceful. Steps include personal hygiene, toileting, brushing, skincare, changing into nightwear, winding down with calming activities, soft music, reading, or prayer. Ensuring lights are dimmed, the room is safe, and water is within reach. For those with memory loss, we use a familiar bedtime routine to reduce sundowning or nighttime confusion. Communication and emotional support. At Guardian Home Care, our caregivers don't just assist physically, they connect emotionally. We encourage clients to express their feelings, share stories, or talk about concerns. Active listening, empathy, and respect are part of every interaction. Mental wellness is just as vital as physical health. Daily logs and family updates. Transparency builds trust. Our caregivers keep detailed logs of meals and hydration, medications, mood changes, or health concerns, activities completed. These records help family members stay informed and support coordinated care with doctors or therapists. Adapting the routine over time. As our clients' needs change, so does the routine. We regularly review and update care plans to accommodate new diagnoses, changes in mobility, emotional needs, feedback from family or medical professionals. Flexibility ensures that care remains effective, relevant, and supportive. Real-life example. A day with Guardian Home Care. Let's walk through a real-life example of a day in the life with Guardian Home Care. From sunrise smiles to peaceful good nights, each moment is a chance to make life a little easier, brighter, and more dignified. Our commitment to you. We know how much your loved ones mean to you. That's why Guardian Home Care is more than a service. It's a family. Our routines are built on love, patience, and professional excellence. When you choose us, you're choosing safety, respect, joy, and most of all, compassion. One of those in Increaslangen. Enjoy the video, and please subscribe my YouTube channel to get informative video regularly. See you soon. Hello friends, welcome to my new videos. How to prevent caregiver burnout, self-care tips for guardians. Caregiving is one of the most rewarding journeys one can take, filled with love, compassion, and service. But behind the smiles, daily routines, and unwavering commitment, many caregivers are silently struggling. Physical exhaustion, emotional stress, isolation, and guilt slowly build up. This is what we call caregiver burnout, and it's more common than you might think. At Guardian Home Care, we believe in not only caring for the elderly, but also protecting and uplifting those who care for them. In this video, we will explore the signs of burnout and how caregivers can practice meaningful self-care for long-term success. Caregiver burnout is a state of mental, emotional, and physical exhaustion caused by the prolonged and overwhelming stress of caregiving. It often creeps in slowly, a missed meal here, a sleepless night there, until one day, the caregiver feels they can't go on. Many caregivers ignore their own needs, believing it's selfish to take time for themselves. But here's the truth. You cannot pour from an empty cup. Self-care isn't selfish. It's essential. Recognizing the signs of burnout early is key. Do you find yourself constantly tired, even after resting? Are you feeling overwhelmed, irritable, or anxious? Do small tasks now feel insurmountable? Are you withdrawing from friends and family? These are red flags. Physical symptoms like headaches, digestive issues, or frequent colds can also be the body's way of saying slow down. Burnout doesn't happen overnight, but once it takes hold, it can deeply affect your health and the quality of care you provide. One of the most dangerous aspects of burnout is isolation. Caregivers often feel like no one understands their struggles. They may stop attending social events, ignore calls from friends, or avoid discussing their emotions. This isolation can lead to depression, anxiety, and even resentment toward the person they care for, and then guilt for feeling that way. It's a painful cycle. That's why building a support network is so important. No caregiver should walk this journey alone. Join a local or online support group where you can speak openly with others who understand what you're going through. These groups provide emotional relief, practical advice, and encouragement. Even just hearing someone say, "I've been there too," can be a lifeline. At Guardian Home Care, we often connect caregivers to such groups as part of our holistic approach to caregiving. Scheduling self-care is not a luxury, it's a necessity. Just as your loved one has a daily care plan, you need one too. Schedule breaks, even if they're only 15 minutes. Read a chapter of your favorite book, take a warm shower without rushing, go for a walk or meditate. Choose activities that nourish your mind and spirit. Block this time off like a sacred appointment, because it is. Mindfulness and relaxation techniques are powerful tools. Practicing meditation, deep breathing, or yoga can reduce stress, calm your nervous system, and bring you back to the present moment. These moments of stillness can recharge your mental battery and improve your emotional resilience. Even 5 minutes of deep breathing can help you face the day with greater calm and clarity. When you're busy caring for someone else, your own nutrition often suffers. You skip meals, eat on the go, or rely on caffeine and sugar for energy. But over time, this depletes your body. Fuel your body well. Eat balanced meals rich in fruits, vegetables, proteins, and whole grains. Drink enough water, limit caffeine and processed food. Your physical health directly impacts your emotional well-being and your stamina for caregiving. Sleep is medicine, yet caregivers often sacrifice it. Whether it's from anxiety, late-night tasks, or interrupted rest due to caring for someone with dementia, poor sleep takes a toll. Create a sleep routine. Go to bed at the same time each night. Turn off electronics early. Make your bedroom a calm, quiet retreat. If you can't sleep through the night, try napping during the day when your loved one rests. Your brain and body need time to repair and recharge. Ask for help. You are not failing by accepting support. You are being wise. Consider using respite care services to give yourself time off. At Guardian Home Care, we provide short-term professional care so family caregivers can rest, run errands, or just breathe. Let trusted friends or family members step in, even for an hour. You need space to recover and reset. Delegate tasks when possible. You don't have to do everything yourself. Assign grocery shopping, medication pickups, or laundry to others. Use delivery services or community resources. Let go of perfection. Accept that not every day will go smoothly. The goal is sustainability, not martyrdom. Sometimes the emotional burden becomes too heavy to carry alone. That's when speaking with a therapist or counselor can make a world of difference. Talking about your feelings in a safe space helps release pressure, gain perspective, and build healthy coping mechanisms. There is no shame in seeking professional support, only strength. Thank you for watching. If you are a caregiver, we honor you. If you know one, share this message. Subscribe for more support, tools, and encouragement. And remember, to truly care for someone else, you must care for yourself first. You are not alone.
Hello, friends. Let's discussion today on Guardian Home Care Family about elder person health, recognizing and managing pain. Do you know how to recognize pain in an elderly person? Many caregivers and family members often overlook the subtle signs. Pain is not always expressed by words, especially in seniors who may struggle with speech after a stroke or who have conditions like aphasia. Recognizing pain is one of the most important skills in home care because untreated pain can lead to unnecessary suffering, restlessness, and even a decline in health. In this video, we'll learn together how to recognize signs of pain, how to score it, what to observe, and how to carefully manage pain with medications and other approaches. We'll also look at the advantages and disadvantages of common pain treatments, and how you, as a guardian or caregiver, can make a real difference in the comfort and quality of life of your loved one. Understanding pain in the elderly. Pain in elder adults can be different from pain in younger people. Aging brings changes to the body. Joints stiffen, muscles weaken, nerves may become more sensitive, and chronic illnesses increase. Many elderly individuals live with arthritis, neuropathy, osteoporosis, or the after effects of surgery or injury. But here is the challenge. Older adults often underreport pain. Some may fear being a burden, others may think pain is a natural part of aging, and some simply cannot express it clearly due to speech or cognitive difficulties. For caregivers, this means paying close attention to the unspoken signs of pain. It's not only about asking, "Are you in pain?" but also about observing behavior, expressions, and reactions. Recognizing pain early allows timely treatment, prevents complications like sleeplessness or depression, and improves overall well-being. Recognizing signs of pain. 1. Facial expressions. One of the clearest indicators of pain is the face. Even when words are missing, the face speaks. Look for grimacing, tight lips, furrowed brows, clenched teeth, or sudden wincing. These small details often reveal discomfort. 2. Restlessness. Restlessness is another strong clue. An elderly person may keep shifting position, rubbing their arms or legs, or pacing if they can walk. But restlessness can also come from other causes, such as anxiety or the need to use the bathroom. As a caregiver, your job is to carefully distinguish the cause. Ask yourself, is this movement linked to pain, or is there another reason? Pain score system. To make pain measurable, caregivers often use a pain score chart. This can range from 0 to 10, where 0 means no pain and 10 means the worst imaginable pain. For patients who can speak clearly, ask, on a scale of 0 to 10, how much pain are you feeling right now? For patients who cannot speak clearly, use the visual faces scale. Show the chart with smiling face at 0 and crying face at 10. Let them point or observe which face they relate to. Special cases, stroke and aphasia patients. Recognizing pain is especially important for people with aphasia or after a stroke. These individuals may lose their ability to speak or express themselves clearly, but pain is still there. It just hides behind silent signals. For them, facial expressions and body language become your main guide. Notice tightening of the jaw, grimacing, tears in the eyes, or refusal to move a limb. Touch can also provide information. Gently press or hold the affected area and observe their reaction. If they pull away, wince, or become more restless, it's a sign of pain. As caregivers, patience and sensitivity are key. Never assume silence means comfort. Silence may mean they cannot communicate. What to do about pain? Once you suspect pain, what should you do? The first step is to ask gently. Sometimes an elderly person will only admit pain after several gentle questions. Try rephrasing. Do you feel any discomfort right now? Is your back or leg bothering you? Would you like me to adjust your position? Next, use gentle touch to check for painful spots. Carefully press along the shoulders, arms, or legs. If the person flinches, that area may hurt. Always record your observations. Write down when the pain occurred, what the signs were, and how severe it seemed. Use the pain score if possible. This record helps doctors or nurses adjust treatment and make sure pain isn't ignored. Pain medications explained. Tablets are one of the most common forms of pain medications. They usually begin to work within 30 minutes. The advantage of tablets is that they act relatively quickly and are easy to administer. However, some elderly patients may have difficulty swallowing tablets, and side effects like stomach upset must be watched closely. When to call a doctor? Always remember, not all pain can be managed at home. Call a doctor if pain is severe, sudden, or does not improve with prescribed medication. Also seek help if new symptoms appear, such as chest pain, shortness of breath, or sudden weakness. Never increase or change medication without medical advice. Guardian home care means being watchful and caring, but also knowing when to seek professional help. Please subscribe our YouTube channel to get more videos. See you soon with the next video. Bye.
Hello friends, welcome to my new video on respiratory problems in the elderly, COPD, asthma, pneumonia, and breathing tips. Let's start the video. As we age, our lungs and respiratory system gradually lose strength, making it easier for health problems to appear. For many elderly individuals, conditions such as COPD, asthma, pulmonary fibrosis, and infections like pneumonia can seriously impact daily life. Even mild respiratory issues can reduce energy, make walking or climbing stairs difficult, and increase the risk of hospitalizations. Recognizing early warning signs and taking proactive steps is key to maintaining independence and quality of life. In this video, we'll explore the most common respiratory problems in the elderly, discuss how to recognize pneumonia, understand the consequences of untreated lung infections, and provide practical tips like breathing exercises, energy-saving techniques, and monitoring shortness of breath. By the end, you'll feel more confident in supporting yourself or your loved ones in maintaining healthy lungs, responding to emergencies, and preventing complications. Common respiratory problems in the elderly. Several respiratory problems are common among older adults. Chronic obstructive pulmonary disease, or COPD, is characterized by persistent airflow limitation, often due to long-term smoking or environmental exposures. People with COPD may experience shortness of breath, chronic cough, and wheezing. Pulmonary fibrosis is another serious condition where lung tissue becomes scarred, making it harder to breathe deeply. The scarring reduces oxygen transfer and leads to fatigue, chronic breathlessness, and sometimes a persistent dry cough. Asthma is not just a condition for children. Older adults may develop late-onset asthma, with symptoms including wheezing, chest tightness, and difficulty sleeping due to shortness of breath. While each condition has unique causes and treatments, they all share one major risk: increased vulnerability to infections like pneumonia, which can quickly become life-threatening if not recognized and treated promptly. Pneumonia in the elderly: recognition and consequences. Pneumonia occurs when the lungs become inflamed, usually due to bacterial or viral infection. In elderly individuals, pneumonia can develop rapidly and often presents differently than in younger adults. Common symptoms include fever, chills, persistent cough, shortness of breath, fatigue, and confusion. Because the immune system weakens with age, Older adults may not show typical signs such as high fever. Confusion or sudden weakness can sometimes be the first indicator that pneumonia is present. If pneumonia is recognized early, prompt medical treatment with antibiotics or antiviral medication, oxygen therapy, and rest can prevent severe complications. Early detection is critical to avoiding hospitalization, sepsis, or respiratory failure. Breathing exercises and energy-saving techniques. Breathing exercises strengthen lung function and make daily activities easier. Pursed lip breathing involves inhaling slowly through the nose and exhaling through pursed lips, helping control airflow and reduce shortness of breath. Diaphragmatic breathing focuses on using the diaphragm rather than shallow chest breathing, improving oxygen intake. Energy-saving techniques reduce fatigue for elderly individuals with respiratory conditions. 1. Break tasks into smaller steps. 2. Sit while performing chores when possible. 3. Avoid lifting heavy items or climbing stairs unnecessarily. 4. Rest frequently between activities. Regular practice of these exercises can improve endurance, reduce anxiety related to breathing difficulties, and help the elderly maintain independence. Daily respiratory health and prevention. Maintaining lung health in older age involves a combination of lifestyle habits and medical care. Encourage regular exercise, which strengthens respiratory muscles. Avoid smoking or exposure to pollutants. Stay up to date on vaccinations, including the flu and pneumonia vaccines. Nutrition also matters. A balanced diet supports immune function. Hydration helps keep mucus thin, making it easier to clear from the lungs. Regular checkups with healthcare providers help detect early signs of respiratory decline. Conclusion and encouragement. Respiratory problems in the elderly, such as COPD, asthma, pulmonary fibrosis, and pneumonia, can be challenging but manageable. Awareness of symptoms, early intervention, and consistent care are key to maintaining quality of life. Always watch for subtle signs of pneumonia or shortness of breath. Use breathing exercises and implement energy-saving strategies to make daily life easier. Support from caregivers and family, along with regular medical guidance, ensures the best outcomes. Remember, lungs may weaken with age, but knowledge, preparedness, and proactive care empower older adults to breathe easier, stay independent, and live healthier lives. Please subscribe our Guardian Home Care YouTube channel to get more videos. See you soon with the next video. Bye.
Hey friends, let's discuss today supporting guardians with Parkinson's disease. Parkinson's disease is a progressive neurological condition that affects movement, coordination, and often emotional well-being. When an elderly loved one, our guardian, faces this condition, their world gradually changes. As caregivers, our mission is to support them, not just physically, but also emotionally and spiritually. In this video, Guardian Home Care offers a complete and compassionate guide on how to care for seniors with Parkinson's disease, focusing on daily care, mobility, and emotional needs. What is Parkinson's disease? Parkinson's disease occurs when nerve cells in the brain stop producing enough dopamine, a chemical that controls movement and coordination. This leads to tremors, stiffness, slow movements, and balance problems. While it typically affects people over the age of 60, the rate of progression and symptoms vary from person to person. Understanding the nature of this disease is the first step in providing meaningful care. Recognizing common symptoms. Common symptoms include resting tremors, usually starting in the hands or fingers, slowness of movement, bradykinesia, rigid muscles, and difficulty with balance. As the disease progresses, facial expressions may lessen, and speech might become soft or slurred. Emotional symptoms like anxiety, depression, and apathy are also common. Recognizing these changes early allows caregivers to adapt routines and environments more effectively. Daily care routines. Parkinson's affects fine motor skills, making everyday tasks frustrating. Simple routines like brushing teeth, shaving, or getting dressed can take longer or feel impossible. Caregivers must be patient and encouraging. Using adaptive tools like electric toothbrushes, slip-on shoes, and button aids can empower seniors to retain independence while maintaining dignity. Establishing a consistent daily routine also helps reduce confusion and anxiety. Mobility is one of the most critical challenges with Parkinson's. As the disease progresses, stiffness and balance problems increase the risk of falls. Regular stretching and range of motion exercises can help maintain flexibility. Encourage walking daily, even short distances, but ensure safety with non-slip shoes, walkers, or canes. Some seniors may benefit from physical therapy to learn techniques like big movements that help reduce rigidity. Fall prevention begins with a safe home environment. Remove clutter, secure rugs, and add grab bars near toilets and in showers. Install good lighting in all rooms and hallways. Parkinson's can cause freezing episodes, where the person suddenly stops mid-step. Training your loved one to use cues, like stepping over a line on the floor or humming a rhythm, can help them move forward safely. As Parkinson's progresses, chewing and swallowing can become difficult, a condition called dysphagia. Offer soft, easy-to-swallow foods like soups, mashed vegetables, and smoothies. Use adaptive utensils and consider meals in smaller portions throughout the day. Encourage upright posture during and after meals, and always watch for signs of choking or coughing. Consultation with a speech therapist may also be helpful. Medication is a cornerstone of Parkinson's management. Drugs like levodopa help replenish dopamine, but must be taken on a precise schedule. Missed or delayed doses can cause sudden stiffness or tremors. As a caregiver, ensure medications are organized, alarms are set, and meal times are adjusted if necessary, since some medications must be taken on an empty stomach. Speech becomes softer and harder to understand as Parkinson's progresses. Seniors may struggle to find words or speak clearly. As a caregiver, practice active listening. Face them when they speak, reduce background noise, and allow time for replies. Simple tools like speech boards or voice amplifiers can help. What matters most is showing your loved one that their voice still matters. Living with Parkinson's isn't just physically draining, it's emotionally exhausting. Many seniors feel frustration, embarrassment, or sadness about losing independence. Depression and anxiety are common but treatable. Encourage your loved one to express their feelings, journal, or talk to a therapist. Engage them in activities they still enjoy: art, music, or simple conversations. Emotional care is just as essential as physical care. Parkinson's can disrupt the body's internal clock and motor rhythms. That's why a predictable routine is so important. Wake up, eat, take medications, and exercise at the same time every day. This creates a sense of control and stability for both the caregiver and the senior, and it reduces anxiety caused by unexpected changes. Being involved in family life and staying socially connected reduces feelings of isolation. Include your loved one in conversations, ask for their opinions, and give them choices when possible. Parkinson's may change how they move or speak, but it doesn't change who they are. Preserving dignity and independence, even in small ways, makes all the difference. Caring for someone with Parkinson's is a labor of love, but it's also emotionally taxing. Don't forget your own needs. Take breaks. Ask for help. Join a support group. Your well-being directly impacts the care you give. At Guardian Home Care, we encourage caregivers to care for themselves with the same compassion they offer to others. Parkinson's disease changes many things, but it never takes away a person's worth. With love, patience, and understanding, we can help our guardians live with purpose, comfort, and joy. If you're caring for someone with Parkinson's, you're not alone. Guardian Home Care is here to guide you, one day at a time, one step at a time. Please subscribe my Guardian Home Care YouTube channel to get more videos. See you soon next videos. Welcome to Guardian Home Care. Today's video is a deep dive into an important topic that affects millions around the world: arthritis in guardians and the elderly. Whether you're a caregiver, family member, or someone managing arthritis yourself, this video will help you understand how to offer the best support. We'll explore mobility aids, pain management techniques, and safe exercises to promote comfort and independence. What is arthritis? Arthritis is a condition that causes inflammation and pain in one or more joints. There are over 100 types of arthritis, but the most common among the elderly are osteoarthritis and rheumatoid arthritis. These conditions lead to stiffness, swelling, and reduced mobility, severely impacting daily life. 3. Challenges faced by guardians with arthritis. Guardians with arthritis often face difficulty performing daily tasks, reduced mobility and balance, chronic joint pain, feelings of dependency or frustration. Recognizing these challenges is the first step toward providing compassionate and effective care. 4. Mobility aids, tools for independence. Mobility aids can restore independence and reduce the risk of falls. Here are some key tools. Canes and quad. Canes, useful for minor balance issues. Walkers and rollators provide greater stability and often include seats for rest. Grab bars and rails, essential in bathrooms and hallways. Stair lifts or chair lifts, ideal for homes with multiple levels. Reachers and dressing aids help with tasks like dressing or picking up objects. 5. Pain management strategies. Pain from arthritis can be managed effectively through a combination of medical and natural approaches. Medications, NSAIDs like ibuprofen for inflammation, topical analgesics, corticosteroid injections, heat and cold therapy. Heat pads relax stiff joints, cold packs reduce inflammation, massage therapy. Gentle massages can improve circulation and decrease pain. Assistive therapies, acupuncture, TENS units, and hydrotherapy. 6. Gentle exercises for joint health. Exercise is key to managing arthritis. It strengthens muscles around joints, improves balance, and keeps joints flexible. Recommended exercises, stretching and flexibility. Neck rolls, wrist stretches, gentle back twists. Range of motion movements, arm circles, heel slides. Low-impact aerobics, walking, swimming, or water aerobics. Strength training, resistance bands or light weights under supervision. 7. Adapting the home environment. Creating an arthritis-friendly home is crucial. Here are some tips. Use non-slip mats and remove loose rugs. Install raised toilet seats and lever-style faucets. Ensure good lighting and clear pathways. Organize commonly used items within reach. These simple changes enhance comfort and reduce the risk of injury. 8. Mental and emotional support. Living with arthritis isn't just physically demanding. It can take a toll on mental health too. Loneliness, depression, and frustration are common. Encourage guardians to join community groups or online support forums. Talk openly with family and caregivers. Engage in hobbies and cognitive exercises. Companionship, empathy, and patience make all the difference. 9. Caregiver tips for supporting guardians with arthritis. If you're caring for a guardian with arthritis, consider these essential tips. Practice active listening. Encourage independence wherever possible. Maintain a daily routine with structured activities. Keep medical appointments and medication schedules on track. Self-care for caregivers is equally important. Don't hesitate to seek help or respite care when needed. 10. When to seek professional help. Consult a healthcare professional if you notice rapid joint swelling, increased pain or stiffness, loss of mobility, signs of depression or withdrawal. Early medical intervention can prevent further joint damage and improve quality of life. 11. Success stories and testimonials. Meet Mr. Rahman, a retired teacher, who regained his mobility through hydrotherapy and daily stretching. Or Miss Ayesha, who now enjoys gardening thanks to ergonomic tools and supportive caregivers. These stories remind us that life with arthritis can still be full of joy and purpose. 12. Final thoughts and encouragement. Arthritis may change how life looks, but it doesn't have to steal joy or independence. With the right knowledge, tools, and compassion, we can help our guardians live better, more fulfilling lives. If you found this video helpful, don't forget to like, share, and subscribe to Guardian Home Care. Hello, friends. Welcome to my YouTube channel, Guardian Home Care. We will discuss today understanding dementia. Dementia is not just a part of aging. It's a serious medical condition that millions of families face each year. The earlier we understand it, the better we can support those affected. In this video, we'll cover everything: the early signs, types, stages, treatments, and most importantly, how to care with love and patience. If you're a guardian, caregiver, or loved one, this guide is for you. What is dementia? Dementia is not one disease, but a term for a range of conditions that affect memory, problem-solving, and behavior. It happens when brain cells are damaged and can't communicate properly. As the damage spreads, it affects daily life, emotions, and even movement. It's progressive and early recognition is vital. Early signs of dementia. The early signs can be easy to miss, but recognizing them can help with early intervention. Watch out for A. Memory loss affecting daily life. B. Difficulty completing familiar tasks. C. Trouble with language. D. Disorientation to time and place. E. Poor judgment. F. Mood or personality changes. G. Withdrawal from social or work activities. If you see these signs, consult a doctor. Early support can improve quality of life. Types of dementia. Knowing the type helps guide treatment. Every form of dementia is unique, and caregiving should be tailored accordingly. Stages of dementia. Stage 1, mild. Mild forgetfulness, misplaced items, occasional confusion, struggling with planning. Stage 2, moderate. Memory worsens, mood swings appear, daily tasks require supervision, and speech may become affected. Stage 3. As dementia progresses, eating and drinking independently often becomes difficult. Many individuals forget how to use utensils, or may not recognize the food in front of them. Sometimes they may not realize they've already eaten and repeatedly ask for meals, thinking they haven't eaten yet. In these moments, gentle support and patience are essential. Severe. Major memory loss, inability to communicate, loss of bodily control, needing full-time care. Understanding the stage helps you respond with the right level of care and compassion. When to see a doctor. Don't wait for things to get worse. If you or a loved one shows early symptoms, seek medical advice. Doctors use memory tests, blood tests, and brain scans to make a diagnosis. Early action gives you time to plan and access care resources. Treatment and medications. While there's no cure, there are treatments to help manage symptoms. Medications. A. Donepezil, rivastigmine, improve memory and awareness. Alzheimer's. B. Memantine, used in moderate to severe cases. C. Antidepressants and antipsychotics, for anxiety, sleep, or behavioral problems. With caution, therapies. A. Music therapy. B. Reminiscence therapy. C. Occupational therapy. Always follow your doctor's guidance when using medications. Healthy living tips to prevent or delay dementia. A healthy lifestyle can reduce your risk of dementia or slow it down. Tips. 1. Eat a Mediterranean diet. Fruits, vegetables, fish, olive oil. 2. Exercise daily, walking, yoga, or even dancing. 3. Stay mentally active, reading, learning new things. 4. Sleep well, 7 to 8 hours per night. 5. Stay social, avoid isolation. 6. Control health conditions like diabetes or high blood pressure. 7. Avoid smoking and excess alcohol. Small daily habits build long-term protection for your brain. Tips for caregivers and guardians. Caregiving is both rewarding and demanding. Here's how to make it manageable and meaningful. Maintain routines to reduce anxiety. Use reminders and labels. Communicate with short, simple sentences. Validate feelings, don't argue. Keep the environment calm and safe. Encourage light physical activity. Take breaks and care for yourself. You can't pour from an empty cup. Ask for help, join support groups, and know you're not alone. When is it time for a nursing home? Sometimes, even the most loving home care isn't enough. Consider a memory care facility when 1. The person becomes a danger to themselves or others. 2. Medical needs are beyond your capacity. 3. You're feeling physically or emotionally exhausted. 4. Choosing professional help is not failure. It's love in a different form. Legal and financial planning. Planning ahead reduces stress and ensures your loved one's wishes are respected. Important steps. 1. Set up a durable power of attorney. 2. Create or update wills. 3. Draft advanced medical directives. 4. Organize insurance and long-term care plans. Discuss these while your loved one can still participate in decisions. Emotional support and love. Even when the memories fade, the heart remembers. A smile, a familiar voice, a soft touch. These things bring comfort beyond words. Be patient. Be kind. They may not remember what you said, but they will remember how you made them feel. Final words of encouragement. Dementia is a journey, and while it may be difficult, it can also be filled with moments of grace, laughter, and connection. With knowledge, compassion, and support, you can help your loved one live with dignity and meaning. If this video helped you, please like, share, and subscribe to Guardian Home Care. Let's build a world where older adults are respected, supported, and loved, one step at a time. Hello, friends. Welcome to my YouTube channel, Guardian Home Care. We will discuss today understanding dementia. Dementia is not just a part of aging. It's a serious medical condition that millions of families face each year. The earlier we understand it, the better we can support those affected. In this video, we'll cover everything: the early signs, types, stages, treatments, and most importantly, how to care with love and patience. If you're a guardian, caregiver, or loved one, this guide is for you. What is dementia? Dementia is not one disease, but a term for a range of conditions that affect memory, problem-solving, and behavior. It happens when brain cells are damaged and can't communicate properly. As the damage spreads, it affects daily life, emotions, and even movement. It's progressive, and early recognition is vital. Early signs of dementia. The early signs can be easy to miss, but recognizing them can help with early intervention. Watch out for A. Memory loss affecting daily life. B. Difficulty completing familiar tasks. C. Trouble with language. D. Disorientation to time and place. E. Poor judgment. F. Mood or personality changes. G. Withdrawal from social or work activities. If you see these signs, consult a doctor. Early support can improve quality of life. Types of dementia. Knowing the type helps guide treatment. Every form of dementia is unique, and caregiving should be tailored accordingly. Stages of dementia. Stage 1, mild. Mild forgetfulness, misplaced items, occasional confusion, struggling with planning. Stage 2, moderate. Memory worsens, mood swings appear, daily tasks require supervision, and speech may become affected. Stage 3, severe. Major memory loss, inability to communicate, loss of bodily control, needing full-time care. Understanding the stage helps you respond with the right level of care and compassion. When to see a doctor. Don't wait for things to get worse. If you or a loved one shows early symptoms, seek medical advice. Doctors use memory tests, blood tests, and brain scans to make a diagnosis. Early action gives you time to plan and access care resources. Treatment and medications. While there's no cure, there are treatments to help manage symptoms. Medications. A. Donepezil, rivastigmine, improve memory and awareness. Alzheimer's. B. Memantine, used in moderate to severe cases. C. Antidepressants and antipsychotics, for anxiety, sleep, or behavioral problems. With caution. Therapies. A. Music therapy. B. Reminiscence therapy. C. Occupational therapy. Always follow your doctor's guidance when using medications. Healthy living tips to prevent or delay dementia. A healthy lifestyle can reduce your risk of dementia or slow it down. Tips. 1. Eat a Mediterranean diet. Fruits, vegetables, fish, olive oil. 2. Exercise daily, walking, yoga, or even dancing. 3. Stay mentally active, reading, learning new things. 4. Sleep well, 7 to 8 hours per night. 5. Stay social, avoid isolation. 6. Control health conditions like diabetes or high blood pressure. 7. Avoid smoking and excess alcohol. Small daily habits build long-term protection for your brain. Tips for caregivers and guardians. Caregiving is both rewarding and demanding. Here's how to make it manageable and meaningful. Maintain routines to reduce anxiety. Use reminders and labels. Communicate with short, simple sentences. Validate feelings, don't argue. Keep the environment calm and safe. Encourage light physical activity. Take breaks and care for yourself. You can't pour from an empty cup. Ask for help, join support groups, and know you're not alone. When is it time for a nursing home? Sometimes, even the most loving home care isn't enough. Consider a memory care facility when 1. The person becomes a danger to themselves or others. 2. Medical needs are beyond your capacity. 3. You're feeling physically or emotionally exhausted. 4. Choosing professional help is not failure. It's love in a different form. Legal and financial planning. Planning ahead reduces stress and ensures your loved one's wishes are respected. Important steps. 1. Set up a durable power of attorney. 2. Create or update wills. 3. Draft advanced medical directives. 4. Organize insurance and long-term care plans. Discuss these while your loved one can still participate in decisions. Emotional support and love. Even when the memories fade, the heart remembers. A smile, a familiar voice, a soft touch. These things bring comfort beyond words. Be patient. Be kind. They may not remember what you said, but they will remember how you made them feel. Final words of encouragement. Dementia is a journey, and while it may be difficult, it can also be filled with moments of grace, laughter, and connection. With knowledge, compassion, and support, you can help your loved one live with dignity and meaning. If this video helped you, please like, share, and subscribe to Guardian Home Care. Let's build a world where older adults are respected, supported, and loved, one step at a time. Hello friends, welcome. Again with me, new videos on the topic, Understanding Incontinence in the Elderly. In the journey of aging, certain changes arise that are difficult to talk about, yet they deeply affect the quality of life. One of the most sensitive yet common challenges among older adults is incontinence, the loss of bladder or bowel control. It affects millions of seniors worldwide, but despite its prevalence, it remains a topic clouded in silence and shame. At Guardian Home Care, we believe that with compassion, dignity, and proper care, seniors can manage incontinence with confidence and grace. Incontinence is not just a physical health issue. It carries with it emotional weight, embarrassment, social withdrawal, anxiety, and sometimes depression. Many seniors feel isolated, fearing that others might discover their condition. This stigma creates barriers to seeking help and support. Yet the truth is, incontinence can be effectively managed, and no one should feel ashamed for something that is often a natural part of aging. To understand how to support someone dealing with incontinence, it's essential to recognize the different types. Stress incontinence happens when pressure is placed on the bladder, like during coughing or sneezing. Urge incontinence is the sudden, intense urge to urinate, followed by an involuntary loss of urine. Overflow incontinence occurs when the bladder doesn't empty completely. Functional incontinence is related to physical or mental impairments that prevent someone from reaching the bathroom in time. And mixed incontinence is a combination of types, often seen in the elderly. As we age, various physical changes increase the likelihood of incontinence. The muscles that control urination and bowel movements may weaken. Chronic health conditions like diabetes, Parkinson's disease, stroke, or arthritis can interfere with normal bladder function. Medications, infections, or even memory-related disorders like dementia can also play a role. It's vital to remember that incontinence is not a personal failing, but often a medical or physiological condition. The first step toward dignified care is a proper medical assessment. Consulting with a doctor can help determine the type and cause of incontinence. This may involve physical exams, urine tests, imaging, or even keeping a bladder diary. Early diagnosis can lead to more effective treatments and reduce unnecessary suffering. At Guardian Home Care, we emphasize proactive conversations with healthcare professionals to ensure a tailored care plan is developed for every individual. For caregivers, assisting someone with incontinence requires patience, understanding, and respect. It's important to create an environment where the senior feels supported, not judged. Always maintain their privacy. Use a soft tone, avoid showing frustration, and make the individual feel in control. Simple actions like asking permission, covering them with a towel during clothing changes, or using discreet products can go a long way in preserving their dignity. There is a wide range of products available today that can make incontinence management easier and more comfortable. Disposable briefs, washable pads, waterproof bed covers, and absorbent mattress protectors can protect both the individual and their surroundings. When choosing products, comfort, fit, and absorbency are crucial. Many seniors prefer items that look and feel like regular underwear. Select products that reduce odor and prevent skin irritation. Creating a safe and accessible bathroom is essential. Install grab bars near the toilet and shower. ensure good lighting for nighttime trips, and consider using raised toilet seats or bedside commodes. Encourage wearing clothes with easy-to-remove fastenings. Make sure the path to the bathroom is clutter-free. These modifications may seem small, but they can drastically reduce anxiety and the risk of accidents. Sometimes, lifestyle adjustments and physical therapy can improve bladder control. Pelvic floor exercises, often called Kegels, help strengthen the muscles that control urination. Bladder training, where the senior learns to delay urination gradually, can also be beneficial. Encourage regular physical activity and proper hydration. While it might seem counterintuitive, drinking too little water can concentrate urine and irritate the bladder, worsening symptoms. Dietary choices can also impact incontinence. Reduce caffeine, alcohol, and acidic foods like citrus and tomatoes, which can irritate the bladder. Encourage a fiber-rich diet to prevent constipation, which can put pressure on the bladder. Every small change can contribute to improving comfort and control. Incontinence can lead to feelings of embarrassment and low self-worth. The emotional toll is just as real as the physical symptoms. Caregivers must provide not just physical support, but emotional reassurance. Listen without judgment. Let them know they're not alone. At Guardian Home Care, we train our caregivers not only in practical incontinence care, but also in compassionate communication and emotional support. We believe every senior deserves to be treated with respect, regardless of their physical condition. Our team provides customized in-home care plans that address medical needs, hygiene routines, mobility support, and psychological well-being. Caregiving can be demanding, especially when incontinence is involved. Here are a few practical caregiver tips. 1. Be patient. Don't rush the process. Seniors may need extra time to get to the bathroom. 2. Stay calm. Accidents happen. Respond with kindness, not frustration. 3. Plan ahead. Always carry extra supplies during outings. 4. Celebrate small wins. A dry night or a successful trip to the bathroom is worth recognizing. Incontinence in the elderly isn't the end of independence or dignity. With the right tools, understanding, and compassionate care, it becomes just another aspect of life we learn to manage together. At Guardian Home Care, we are honored to walk this journey with families every day, turning discomfort into dignity, fear into freedom, and isolation into support. Thank you for watching. If this video helped you better understand incontinence in the elderly or gave you insight into caring for a loved one, please consider subscribing, sharing, or reaching out to Guardian Home Care.